doctors are answering your most embarrassing questions.
Nothing's off limits.
Questions so embarrassing we had to conceal our guest's identity. Doctors.
We're going to move on to a question from Jay, who happens to be in our medical confessional because he has an embarrassing issue. Jay, what's going on, my friend?
Thanks, Travis. When I was in my 30s, I was about 100 pounds overweight. As a result, I had a couple hemorrhoids, and I started eating right and exercising. The hemorrhoids went away. I still have what I would call a couple dingleberries left. Be little like fleshy things, kind of hard to clean around and gets in the way, and it's not necessarily uncomfortable, but it's truly a nuisance.
Well, we in fact have proctologist Dr. David Rosenfeld with us today because this, this is your area of expertise.
Yeah, it's right up my alley. Absolutely. And as a proctologist, I can say that it is so embarrassing for patients to come in gynecology as well. So to be here and tell your story, I can tell you you resonate with 40 to 60% of the people at home that are saying, oh my gosh, I have the same problem. I can tell you without seeing what's going on, primarily it is benign. It could be hemorrhoids still, it could be the extra folds of skin, hypertrophy in anal papilla, which is a skin tag from the inside of the anus that comes out, or even a wart. It's possible. But without seeing, I can't make the diagnosis. But if you'd like, I'd be more than willing to examine you backstage so we can find out exactly what's going on and just, as we say, get to the bottom of it.
Jay, what do you think?
I think this is the fun part. I can't wait.
So I love this because, look, if you have a problem down there, it's been bothering you, it's better to get it checked out. You don't need to do it on national TV, but Jay is doing that. We're going to check back in with Jay and Dr. Rosenfeld a little bit later in the show to see the results of your exam and have some great takeaway for our viewers at home.
The doctor's prescription you've been afraid to discuss. That's coming up.
Earlier in the show, we all met Jay, who had a question regarding past hemorrhoids. He had some extra skin hanging on his backside. He is now backstage with proctologist Dr. David Rosenfeld, who just provided an exam. And Dr. Rosenfeld, I hear you have a clear diagnosis. Take it away. What's going on?
I have great news for you. What you have, one, is not cancer. Medically speaking, it's called a hypertrophied anal papilla, which basically is a skin tag inside the anus, which has gotten larger. The scar tissue kept growing, and now it's coming out. The bad news is the only way to get rid of it is to surgically remove it, which I do in my office.
How much would something like this cost?
I will tell you, Jay, because of your bravery coming on the show and probably helping so many people, I'm going to do this au gratis for you for being on the doctor's show. You just come to my office and I'll take care of it.
Thank you very much.
You're welcome.
Thank you very much.
My pleasure.
Dr. Rosenfeld, can you define au gratis for us? Kidding. Kidding. I'm kidding.
Au gratis means I will do it at no charge.
Wow. Jay, thank you for coming forward. Dr. Rosenfeld, thank you as well. We really appreciate it. And look, today's prescription is a really simple one. No question is too embarrassing for your doctor. We've seen it all. So if you have a problem, make an appointment to see your healthcare provider.
Exactly. And there's nothing that we haven't heard or we haven't seen. Don't ever.
That is very true.
Don't ever, like your denture in for 10 years. Come on. No.
Right.
No, we've heard it all. We don't judge. We're here to help.
And
Okay, docs.
Don't lose sight of that.
Exactly. What he said.
The reality is you're not alone. Get it checked out. Thank you all so much for watching.